So I have developed through my doctoral research what's called Healing the Healer series. So this is a brief introduction to the Holistic Resilience Recharge, or HER. This is to identify the consequences of working in trauma exposed and trauma engaged roles. Oftentimes, those of us, and to be fair, it I don't even know if it's debatable anymore post COVID. I'm not quite sure any of us that haven't experienced some sort of trauma in the workplace or dealing with some sort of stress. And that's a little bit about what drove me to do this. So, a little bit about me. So, I am a licensed clinical social worker by trade for the last 20 plus years. I've worked in micro practice pretty much and some meso, started in community mental health for the majority of my career. And I kept seeing these gaps. I kept having these conversations about supervision or lack thereof, or, do more with less. And, like, what are we doing and what are the impacts and consequences? And most of the trainings that I attend or really how to be better for the populations we serve. How do we show up for, groups and individuals, but what are we doing for us? And again, when I started researching the literature in my doctoral program, it came to be that there was not one identifiable pathway to help mitigate the impacts and the consequences that we're all experiencing. So I'd like to share that with you today. Another couple area of interest are in using implementation science, especially in social work, and the creation of sustainable practice inclusive of equitable partnerships. I really believe that we're stronger together and we do rely upon each other. And moving forward, my little clicker was not working. So just a couple disclosures. This workshop is the result of my doctoral level research. It has been IRB approved. The training is not a substitute for therapy or supervision. Super important to continue to have that. I'm not receiving financial compensation today for this training, so it's really just me sharing my work and my research. No other conflicts, and this will offer you one CE credit. As I begin, again, land acknowledgement, I come to this workshop is coming to where I'm seated in the ancestral and unceded territory, the Secretog people. Recognize the elders past and present and their longstanding stewardship for this land. If you'd like to know what land that you are coming to me from, here is a wonderful toolkit right here to figure that out. So our agenda, so we're a little bit, we're right on there. So just a welcome and a plan for our shared time. Going to move into an introduction and overview, a little bit of the history and foundations of trauma-engaged roles and the trauma-engaged occupational consequences. So I have some video examples that might make this a little bit more interactive, and then we have some closing and hopefully time for some questions. This is an interactive training. I'm going to be asking you to drop information in the chat. Feel free to use the emoji button. I think that helps engage us all, and that's what this is all about. It's about connecting. Let me go here. So Holistic Resilience Recharge, or HER, it's a brief overview. So this is a 7-hour workshop program, but I'm taking a snippet from a lot of the work that I've done, and I've put it into an hour. So we may not get to as much as I'd like us to, but we're going to try to move through as best we can. This is a longer program. It details how working in trauma has these impacts and consequences. And I know I'm going to say that a lot. I'm going to repeat myself because it's something, these are conversations I found through my research, through a needs assessment, through the presentation of this work with hundreds of people we're not having. People in the fields come to me after 20 years in supervision and telling me, I'm not getting adequate supervision. What does that even look like? We don't have those standards of care. So again, this workshop today is a little information heavy in the beginning. It's a little more high cognitive burden as we move through this. The actual skills that I want to show you are not new. So it's low cognitive burden, low cognitive shift. And again, the holistic resilience recharge is not revolutionary. You all are revolutionary. You are boots on the ground. You are doing the work in whatever capacity that you're coming to me from. So we want to honor that. We want to take the skills you already have, but then also find time to shift energy to give it back to you. So that's pretty much what this is. The modalities and some of the information I'm going to say are going to be very familiar, and you're going to go, Melissa, I know this already. And I'm going to say, yeah, you may know it, but are you applying it to you? So let's go. So our goals for our shared time, I'd like to differentiate the different consequences of working in trauma-engaged roles, and that's secondary traumatic stress, vicarious trauma, compassion fatigue, empathy fatigue, and burnout. So I'd like to identify your current range of consequential stress. We have a little tool called the Pro-Call, and I will get to that. I'm not quite sure if any of you have heard of the Pro-Call. I, in 20 years, had not. So I think it's eye-opening just as an assessment tool to be able to measure what is your element of secondary traumatic stress. What are we talking about here? Let's apply and integrate the knowledge that we gain today to also have those conversations with the supplemental video examples and differentiate those characteristics. My goal is to have us talking more about that with each other. I like you to leave here with the importance of having support, connection, and just looking around here at all the faces on these cameras and screens and just trying to reach out and connect. Again, post-pandemic, we've been a little bit more challenged with our social connections, and that's one of the highest requests when it comes to mitigating burnout. So again, goals for a shared time to kind of simplify it, and feel free to go back to these slides. Some knowledge and skills, awareness and integration, how we put that all together, how do we operationalize that knowledge and skills. We want interactive exchange and connection here, which we'll have, and some reflection and feedback. Again, I'll put my LinkedIn at the end and my email. While there's quite a number of you, I'm also open to partnering, collaborating, and connecting. I think that's how we grow our field. So the overview of the Holistic Resilience Recharge. This is a four-part training. So it incorporates peer-reviewed research and gray literature. Gray literature is sometimes not widely recognized in academia. It's starting to gain more traction now because people, again, not everybody has access to higher level education, right? But we have people that are doing the work that are in practice that are most vital that we want to hear from. So that's a beautiful part of implementation science. It incorporates that. And as a first generation college graduate, it was really important for me to allow that 20 years of experience going back for my doctorate to be able to integrate that with research. Research alone and practice alone, we need each other. So again, the experiential knowledge, everybody here is coming with this wealth of knowledge. How do we share that? How do we synthesize that and gain, more support in the field? So, informed practice regarding the consequences and impacts. So, again, I'm saying, so really, HRR was developed due to a consistent lack of clearly articulated integrated solutions. Why? The terms secondary traumatic stress, vicarious trauma, empathy fatigue, compassion fatigue, and burnout are often conflated in literature. That was a big thing for me. It's actually differentiated by the VA, our very important organization that kind of denotes how we look at trauma and post-traumatic stress disorder. They have it separate, but in literature, sometimes those terms get conflated. I will provide you information to un to detach them and look at them as different. So this is again familiar. It's some of the modalities, the theorists that I'm going to speak about are going to be familiar. This was built with ongoing adaptations. If you see this and you go, this doesn't work for me, this is ridiculous, reach out, let me know. I want to hear your feedback. I want to know if this is something that you think speaks to you or if there's something that we could do a little differently together. So here we go. So today, a couple activities, self-monitoring and awareness, and we want to synthesize knowledge. A couple exercises, again, will be interactive, and then we'll see what we have time for. I'm going to pause here. Just dropped a lot of background. Just want to check in. How's everybody doing? I'll be checking in throughout the workshop. A really big piece of an interactive training is just seeing how you are. I don't want to, roll you over with just information and just, talk at you. I want to speak with you. So participation is encouraged. It's not required. Please be respectful of everyone sharing the space. We're a large group today, but all questions and feedback have value. So a little bit in the chat. If you could just drop in the chat briefly. What brought you here today? I'm grateful that you're here to share this space, but tell me what brought you here and what are you hoping to take away from the training? I'd like to hear from you. I'd like to see some things that you're spending your hour with me right now to listen to this. What are you looking to get? So let's see a couple things. Curiosity, gain knowledge. I want to learn something new. I want to hear something different. Okay. That's wonderful. Keep it coming and please feel free to drop whatever you'd like in the chat. So the reparative quest, let's begin. Have you heard of this? Is this a familiar or new concept? The reparative quest was introduced to me early in my career, and it was something that really stuck with me. It's what pathway are you on in doing the work? Everyone here is a healer. You've all been called to heal. What called you? And I think sometimes in the work that we do, and the time that we spend, and the jobs that we get, and the roles that we have, we tend to get away from that. We get away from the very beginning of what got us into this work in the first place. The holistic resilience recharge is just that, to holistically, naturally bring you back to what started you in this field in the first place. Are you honoring that reparative quest? Again, connecting to this promotes healing throughout the work we do. Sometimes the reparative quest can also be difficult, right? If we're constantly in a place where maybe we were hero child, or maybe we were someone that was sacrificial, then sometimes we're doing more of the work that we need to be doing, right? We're not supposed to be doing more than the person that we're working with or the population, right? When we tend to overdo. So again, the reparative quest helps us build what? The countertransference. That is very useful in all the work we do. We call upon us. Again, some of what I'm saying is that we've gotten away from the us part, right? The whole therapeutic alliance, that's the magic that we create in that special space with other people, but you're a piece of that. And I want to get us back there. So again, the reparative quest, interactive share. If anybody has the desire or you feel comfortable being vulnerable, please share like what originally brought you to do this work, what helped you decide to be in your chosen profession or your current role, what sustains you in that current position or role. Has anything shifted or changed? You know, did you ever set out to want to be in a certain capacity and then all of a sudden just life had you do something else that you're grateful for or not? Do you wish you could get back to where you originally wanted to be? Is there time, energy, capacity? Again, these are the pieces that I'd like to discover with you. So again, do you see any correlation between your role, your process of helping others, and that reparative quest? And if you disagree, you're like, Melissa, again, I don't love that, then you let me know too. I love to hear, even if you don't agree, because I think that's where we can find mutual collaboration in that as well. So the significance of research. So part of my research was really shocking when I started, really getting into literature that social workers are the primary providers of mental health services, up to 89% of all care. And I was like, wow, and frequently exposed to direct and indirect trauma, right? Post-traumatic stress disorder symptoms are prevalent in social workers at the rate of 15 to 50% higher than the average general population of 7.8%. Kind of calling back to that reparative quest, what is going on in our own personal lives that we now bring into the rooms or spaces or with people that we're sitting with. We might also have some of that post-traumatic stress piece, right? And we might be in a recovered space, but it doesn't mean that we're not susceptible to being impacted by the work that we do. Lack of prioritizing self through sustained mentorship, supervision, or effective modalities in any consistent basis. And again, you might say, Melissa, I'm doing this. I'm great at doing meditation. I'm like, well, that's wonderful. But let's talk about, is there anything else that you might want to do also? Not just work on the self, which sometimes we see the populations we serve do. It's just a constant work on the self, work on the self. I'm like, sometimes we get to enjoy that too. So again, you might be doing great work, but are you able to sit and enjoy it? It's really important that when we work in these spaces that we still are able to create time for us. But again, some of what I'm going to show you today hopefully will shift your cognition and be able to do just that. So a little bit more of an interactive share. Like I said, it's participatory. Please share your role, your setting, and your population. Where are you coming to me from? What populations are you working with? Are you in community mental health, doing more with less? Are you in private practice and maybe not able to access supervision? Are you working two, three jobs? We know people in the healing professions typically do work more than one role. So we have school-based, we have community mental health, we have veterans, we have so many different populations. Like, and I want us to take a look at this is our team. Like we have this great resource of each other. Are we able to plug into that? So part of the holistic resilience recharge is just doing that, is connecting. So now we're going to come to the protocol. Protocol is a 30 question assessment tool developed by Dr. Beth Stam and Dr. Charles Figley, who I had the pleasure of connecting with and who gave a nod in approval for this program. He just retired from Tulane. Anyone that went to Tulane, he is one of the founders of a lot in our field of trauma. So this 30 question test can actually assess to see, do you have any secondary traumatic stress or any compassion fatigue, burnout, and also compassion satisfaction. Compassion satisfaction is insulating as far as what it takes to be able to continue sustainment in the work, but it's not enough because we also need to know what else is going on. Jason Hotchkiss is a professor at University of Buffalo. I had the pleasure of connecting with him. He developed an adaptation of a 12 question protocol that I'm going to share with you today by asking his permission, and he's happy to share it. So I ask you today, right now, if you can just grab a piece of paper, we'll just take a moment. These are 12 questions I'd like you to answer. It's a Likert scale, so 1 to 5. I'll just pause for a few seconds. Then we're going to score it because, again, I don't know who here or not is familiar with the protocol. I was not, and it was eye-opening when I took this myself. I'll give another couple moments. Maybe just by a little show of hands or a little thumbs up if everybody is so there isn't a link right now. I have the questionnaire on the screen, but the link is in the slides. This adaptation was granted, I was granted permission to utilize this for this training, but the regular protocol is online. So we have 12 questions. We'll pretty much feel confident that we've completed this. So what I'd like you to do is I'd like you to split these numbers, questions 3, 6, 9, 12, questions 2, 7, 8, 11, and questions 1, 4, 5, 10. Sure, I can show it. Sure. The slides were emailed to everyone, and I'll make sure that there's a couple different shifts that I made in this slide deck. I will definitely make sure that Agents of Change has the updated slides, and they'll be mailed out to you. So if everybody's confident that they've completed these, oh, congratulations on your retirement. Is everyone pretty okay with these questions? We'll make sure that everybody gets the slides. We're going to move on to scoring them. Okay. So 3, 6, 9, 12 is one grouping. You multiply that by 10 and divide by 4. 2, 7, 8, 11 is another grouping. Multiply by 10 and then divide by 4. 1, 4, 5, 10. Multiply by 10 and then divide by 4. And what I'm curious is if you don't mind, when you have that number, could you drop that number in the chat? 3, 6, 9, 12 is your compassion satisfaction. 2, 7, 8, 11 is your burnout score. 1, 4, 5, 10 is your secondary traumatic stress score. Take your time. We have another few moments before I move on. So that you know that anything above a 15 means we're on the higher end. And again, for some people, the math is very challenging because it's definitely taking a few questions. But the point of this is to say that oftentimes we may be satisfied in what we're doing, but we're not recognizing that there's an underlying component of burnout or another underlying component of secondary traumatic stress. So this, again, I encourage you to go online. I'm going to put it in the chat. It's Procol, and this will be in the slides. You can look that up online. There's a 30-question test. So for those that did not know it, like I definitely encourage you to take the 30-question Procol and come out with your scores and take it periodically to try and, again, evidence to yourself, use that assessment tool to show yourself just where you're at. So anybody over 15, we're talking, anything 10 or under is considered low and, not as concerning. Anything 10 and up, and especially over 15, is something that we really have concern about. So let this be something that is a pathway and a bit eye-opening. So again, take a moment to check out the protocol. These elements, again, are just ways to evidence that these nuanced consequences are occurring, but we're not talking about them. So the significance, get to know your numbers, get to know the value of what that looks like. Do some of your own quantitative data collecting and start to see if there are trends. Certain times of years we know might make it more difficult than other times. Um, so please, if you had you known about the pro call before today, or is this something new? And again, there will be time to go over scores independently. It is absolutely guided by the website. So I don't want people to worry that they missed out on answering the questions. You'll have this in the slide. Allostatic load. So now that we talked a little bit about the ProQol and what your numbers are and secondary traumatic stress and burnout scores are, allostatic load is typically used in medicine, but it also is starting to be widely used across healthcare systems. Allostatic load is the amount of capacity stress that your body can handle before the dis-ease of self, thanks to Louise Hay, disease. So when we have high secondary traumatic stress, we're on the verge of burnout, our allostatic load is too high. And it does not clear away as easily as our sometimes dopamine hits come, right? Because a lot of us now are in this culture where we have these phones and we have access to social media. And what do? We sit and we're able to get some dopamine. We look at some cool things, we look at some fun things, but what that's encouraging, unfortunately, it's called a dopamine cortisol cycle. And it's a little bit more in depth. I will explain a little bit more lately, but the cortisol just pumps adrenaline. It just makes us feel more stressed, and the allostatic load climbs. It is a tough system to reduce, and that's why we need the holistic resilience recharge and to have conversations about what's your burnout score. What would happen if you went into your place of employment and you said, "Hey, have you heard of the protocol? Can we all take it together and can we just talk about what this means? Do we need to start implementing different programming at our facility, at our organization to be able to mitigate the impacts and the effects?" This is a real world measure of stress. It is empirical and it's not about personal failure. These numbers aren't to indicate pathology. They're not saying that you're a problem. It's saying that we are constantly asked to do more with less and we don't know what to do beyond that. So, just again, the beginning part of this program is to impart knowledge from what I've assessed from literature. I did the work in assessing literature, so you didn't have to, but this is what's coming up when we talk about these terms about working in trauma engaged occupational roles. So our first skill is called noticing. Again, it has its roots in ACT, DBT, MBSR, so that's acceptance and commitment therapy, dialectical behavioral therapy, and mindful-based stress reduction. It's a body scan, right? Not a progressive muscle body scan, but just a scan. Sometimes we can just take notice of what's going on in our bodies. Oftentimes, when we're busy, we're fixated, we're focused, we are detached from our body. We're here in our head, we're not in our body. It's really important for our parasympathetic nervous system to function appropriately for us to notice. So, this is what I would like you to think about is how do we break those dopamine cortisol cycles, right? When we want to reach for something to be able to balance out some of the stress that we're experiencing, doom scrolling, maybe getting back to nature. We're finding out a lot again, empirical evidence to say just getting outside, just being able to put your feet on the ground. For some, it might be a little too outside the box or even a little woo-woo, but I think there's something to be said from stepping away from the work or stepping away from the roles. How many roles are each of us conducting? Are we family members? We're working capacity. We are driving people around. There's so many different things that we are responsible for, especially getting back to now, those of us that are parents getting back to this school year. How are you going to balance your time and energy with all the things that you're going to need to do in these next few months? So again, our circadian rhythm starts to get disrupted and it just causes us more stress. So again, this is your first skill of noticing. It seems simple enough, but you know what? I would say my challenge to you is to do it each day. Do it 15 times a day. Just sit in your seat and just notice. So akin to grounding, but just notice. You don't have to do much with it, but just start to be back in your own head. So the explanation and differentiation of the trauma-engaged occupational consequences, or the TEOCs. So I have a couple acronyms, right? This is the theoretical foundation and the practical application of trauma-exposed work. So as I'm going through this, are any of them familiar? So the theoretical introduction, right? A lot of what the Holistic Resilience Recharge has, it comes from the work of Piaget, of Yalom, of Jung, Salibi, Figley. So all these big names that most of us in the field have heard of one or another. So Piaget, of course, has our developmental with our assimilation and our accommodation, right? When children learn that there's a dog, and let's say it's a golden retriever, and that as time goes on, you see a German Shepherd. Well, we have to accommodate that knowledge because we thought that there was only one. Similar to what this is, right? We think there's only perhaps one way as we get comfortable doing it. I'm asking you to challenge some of that thinking so we can broaden our scope and then integrate that. Yalom is more existential. There's more pressures in the work that we do. What does that look like? That's why I like that book, The Gift of Therapy. He sometimes I'd say really goes for it, and he is a psychiatrist, so a little bit different. But the way he partnered and collaborated, again, might not be everyone's cup of tea, but it's interesting to hear his take on how he approached therapy and how he really put himself in this human role in the seat. Jungian, of course, Jungian's not typical for trauma work, but I really do admire the shadow piece coming up and the shame cycles that, again, sometimes for us, it's not just about the work we're doing, it's about who we are. Do you hang up your hat at the end of the day? Are you on call overnight? What happens if people need you and you don't have any more energy to give? You don't have it. So then we start to be what? Reactive. So starting to know, and then once we're reactive, we have what? The emotional hangover after. We feel guilty, we feel badly, we feel inadequacies, we feel imposter. That's what I want us to address. So with Salibi, strengths perspective, big component of our social work education, just looking and trying like the foundation of the motivational interviewing piece. And again, Dr. Figley, trauma exposure consequences. His work is amazing. His book, Compassion Fatigue from 1995 is still, again, very much sought out after and very much the foundation of a lot of trauma work today. So how does this all relate? So our practical introduction, right? We have our theorists, now we have our practice. So we have Dr. Marshall Lenehan, who is the creator of DBT, Dr. Sears, who again speaks about ACT, NBCT, Dr. Frank Anderson, again, huge in the IFS community, Dr. Gentry, forward-facing trauma, right? These are pioneers that took the information of theorists and started creating programs. And Dr. Brian Miller with the CSERT, which this program very much is an adaptation of all of these. I've tried to incorporate what the greats have said and just take pieces that I think, again, as a neurodivergent learner, has small shifts in cognition that can yield great results in energy. So it's not about doing more. I'm asking you to just sit and just recognize what's going on for you. Do we have the awareness that we have for every other piece of our life? Do we have that for us? Our trauma engaged occupational consequences, our TEOCs, are secondary traumatic stress. They are similar to PTSD symptoms due to direct or indirect trauma. The vicarious trauma is a cumulative exposure to stress that alters worldview. It's linked to potential shifts in identity. Compassion fatigue is emotional exhaustion due to sustained caregiving. Empathy fatigue sometimes gets gets lumped in with compassion fatigue. And I'm here to separate that because empathy fatigue is an over identification. If you've ever been in a situation where you felt more reactive, where you were like, what? Or, okay, I got it. That's empathy fatigue. Compassion fatigue seems to be more pervasive and more long, more it takes time to kind of erode sometimes our boundaries. Empathy fatigue is that quick reactive piece. And burnout is occupational strain, sometimes recognized by cynicism that doesn't necessarily need trauma to ignite. But as you saw with that pro call, those that were able to do it and those that weren't, apologies, but you'll have time after the session, is really marked by fatigue. And again, these are all pieces that erode our resilience. So here is a poster. I do present all over the country. I do speak about my research, and this was a poster that I had that I just put in here. Again, you can feel free to look back at this later, but there are distinctions and explanations about what each of these trauma-engaged occupational consequences are, and sometimes how they're conflated with each other in literature. And my biggest sticking point with some of this when I started to discover this was if we're not defining what's going on for us, how the heck are we going to remedy it? What are we doing? So there are a plethora of different interventions and different, modalities to use. But how do we know what's going on if we don't know how to identify it? So I really love the DBT, name it to tame it. I think it's important to differentiate what's going on for us and start to have those conversations. This will come up a little bit later. But oftentimes, burnout is a badge of honor in a lot of the capacity, a lot of the work that we do. If you skip lunch, if you work late, if you take on more patients, if you do more with less, that's amazing. Like you're a hero, right? If you talk about your anxiety, you talk about your secondary traumatic stress, you're having nightmares at night, you're waking up in a cold sweat. Oftentimes, these are not welcomed conversations, and it seems to be like that's a you problem. That's not an organizational problem. That's, something's going on. You need therapy and you need medicine. And that might be so. And there's nothing wrong with that. But I'm talking about what are we doing on a whole as a field of mental health to help support those conversations, right? That there's not shame. And I think we're seeing a lot going on in the field right now. There's one famous case right now going on with just how an individual who had postpartum may or may not have been the symptoms, and the mental health system may or may not have been supportive in this. So again, are we working with each other or partnering with each other beyond the silos that we're in so that we can not let people fall through the cracks? I don't know. And I evidenced by what I'm seeing as of late, it's still a gap. So again, feel free to come back to this and reference it as much as you'd like. Gonna pause here and check it. I know this is again a little bit information heavy. How's everybody doing right now? Are you doing all right? Like a little sip of water? Do you want to just do like a little stretch, engage in some movement? And again, where are your thoughts and feelings and emotions in your body? Consider having some awareness through just noticing. Sometimes talking about these topics can actually ignite our anxiety or can make our stress grow even more. So I just want to be cognizant of that and just make sure that I check in and see how everybody's doing. So again, this is another skill, not unfamiliar, but something that I'd like us to all consider. It's called self-monitoring. Now that you're noticing you, right? You're in the seat and you're kind of grounded and you're just being with you. What kind of way do we can do to evidence that, right? How do we quantify that? So self-monitoring again has roots in cognitive behavioral therapy used in subjective units of distress. Those that have been around a while in the field, we used to have a GAF score, so we would say the Global Assessment of Functioning. So I'm going to say for us, choose your scale, 0 to 100, 0% to 100%, $0 to $100. When you wake up in the morning, what's your number? What are you starting the day at? If you're starting the day after a great night's rest, maybe you're an 85, maybe you're a 90. Everything you do that day either replenishes or depletes that energy. So I would like you to think about how you could measure how you are right now. And if you feel comfortable, please drop it in the chat. Just knowing that everything we do will take that number up and down. And my research lends itself to saying the more we are aware of where we're at, the better chance we have of doing something about it. Again, oftentimes, like I'm saying with the reparative quest, we sometimes sacrifice ourselves to do the work. We're not necessarily in our heads, in our bodies as we're doing that, or what's the ramification when we don't. So, again, I want you to take time out of your day, out of your moments to notice you and then assess where am I at? Where am I at right now? And as things go on throughout the day, maybe take time at the end to do an inventory and just say, how am I ending my day? And again, after a night's sleep that maybe wasn't the best, are you starting off at a 60 and then there's traffic and then you get to work and then coffee or tea spills and then you get a phone call that you have to go rush to take care of a family member. What is your number? What are we working with? Are we at capacity? So, little video examples. So we have a little bit of time. I'm going to show you just two examples. One is there's a couple on here again that I won't get to do all of them, but I'm encouraging you to look at them after. One is from a movie clip. It's called Good Will Hunting. And this is something that I'd like to share with you because I think it's a great indicator of what happens sometimes when we don't take care of us. To set up the scene, there is cursing in the scene, content warning, trigger warning. It does refer to, there is an element of violence. There's a violent piece where Robin Williams does grab Matt Damon by the throat. And it's a scene where I'm going to set this up. Robin Williams' wife has recently passed after a very difficult battle with cancer. And Matt Damon is a student who is being forced to do therapy in order to discover himself. And he's been through a multitude of therapists. So we're landing on this therapist at this time. So I'm going to go ahead and do this.
United States of America, complete history. Volume 1. Jesus. You want to read a real history book? Read Howard Zinn's People's History of the United States. That book will fucking knock you on your ass. Better than Chomsky's Manufacturing Consent? You think that's a good book? And people baffle me. Spend all your money on these fucking fancy books. You surround yourselves with them. The wrong fucking books. What are the right fucking books, Will? Heck, whatever blows your hair back. I've got much hair left. Hey, you know you'd be better off shoving that cigarette up your ass. It'd probably be healthier for you. Yeah, I know. It really gets in the way of my yoga. You work out, huh? What, you lift? Yeah. And Alice? Oh, free weights. Oh, really? Yeah, free weights, huh? Yeah, big time. Just like that. What do you bench? 285. What do you bench? You paint that? Yeah. You paint it? You sculpt? No. Like art? Like music? It's a real piece of shit. Oh, well, tell me what you really think. Just the linear and impressionistic mix makes a very muddled composition. It's also a Winslow Homer ripoff, except you got Whitey rowing the boat there. It's odd one, eh? It wasn't very good. That's not really what concerns me, though. What concerns you? Just the coloring. You know what the real bitch of it is? It's paint by number. Is it color by number? Because the colors are fascinating to me. Are they really? What about that? I think you're about one step away from cutting your fucking ear off. Really? Oh, yeah. Think I should move to the south of France, change my name to Vincent. You ever heard the saying, any port in a storm? Yeah. Yeah, maybe that means you. In what way? Maybe you're in the middle of a storm, a big fucking storm. The sky's falling on your head, the waves are crashing over your little boat, the oars are about to snap. You're just pissing your pants, you're crying for the harbor, so maybe you do what you gotta do to get out. You know, maybe you became a psychologist. Bingo. That's it. Let me do my job now. You start with me. Come on. Maybe you married the wrong woman. Maybe you should watch your mouth. Why don't you write that, Chief, all right? That's it, isn't it? You married the wrong woman. What happened? Would she leave you? Was she, banging some other guy? If you ever disrespect my wife again, I will end you. I will fucking end you. Bet the Chief. Time's up. Yeah.
But another piece of this that I speak about in a longer presentation is that also you see the clip. He's also a veteran, right? So he was also in the war, and you see the picture on there. So again, I know it could be a little graphic, and people might have already seen that before. Um, that's an indicator of when we don't necessarily have the supports, take care of ourselves. And again, it's a movie, but I thought it was a good indicator to say that that's when our secondary traumatic stress, right? Something that we've gone through, our own post-traumatic stress shows up. Our empathy fatigue, we're just tired. And a lot of us, as I saw earlier, are working in the capacity with populations that are in situations that are in and that are deserving of care, right? And sometimes again in community mental health, which I saw some of us work in, you just have to do more with less. What do you do when you have your own personal struggles, and how does that show up? I'm going to just show one more clip um, that I have queued up here.
There's no empathy fatigue. Empathetic and compassion is the way we're meant to be. That's our nature. Why would we get tired of being our nature? We get tired not because we have too much empathies, but because we don't have enough for ourselves. So we keep giving and giving and being out there and out there and out there, and we don't take care. Your question began with how do I take care of myself, and that's exactly the point. Is that when we don't have enough empathy for ourselves. So what we get tired of is lack of empathy for ourselves, not our empathy for others. That's not going to make you tired. But if you have empathy for yourself, you're going to have boundaries. And if you don't have boundaries, you don't have empathy for yourself. So
I always rephrase that. It's not compassion fatigue, it's lack of compassion fatigue, lack of self-compassion fatigue. That's what makes us tired.
So again, does anybody have any reactions to those videos? Is it something that you agree with, that you, um, can identify with and say,
Certification and the credentials you need to teach.
sorry, a little bit of a technical thing. I always thought it was really impactful to see it played out because again, when it stays in our head and we have conversations, even when we experience anxiety or we experience something, even when we have anxiety, sometimes we just tend to laugh it off, right? We just think like, oh, I have anxiety, and this is something that, we'll have, haha. And is it really a haha? Are we really doing ourselves a disservice by not saying to one another, hey, are you okay? You're working in the capacity where you go out to your car at night and you feel frightened, but you don't know where that's coming from. Are we having those conversations of if you feel safe, you feel respected, you feel heard in your professions? So again, the effects of trauma-engaged occupational consequences are reduced empathy and potential ethical challenges. And again, this is not to pathologize or to point fingers, but ethical drift does happen. Sometimes our hearts are such in the right place. Think back to the reparative quest that we might find that we just purchase a few groceries for someone that we're working with, or we don't have enough supplies at work, so we'll go pick them up and that's okay. We'll pay it off on our credit card. There are so many situations where we start to drift our ethics just because we don't know what else to do, but because we're not having the conversations and putting more pressure on the organizations. They're supposed to be there to support us, right? So exhaustion, health deterioration, and disease, sleep issues, physical ailments, immune issues, mental health, and other maladaptive ways of coping. Those all become present, and we just kind of make it work with what we have until we retire, or if we can. And there's a couple other pieces. There are inconsistencies in staff, high turnover. You see, when people start to experience the trauma-engaged occupational consequences, they call out of work. They're exhausted. They need mental health days just to catch up on maybe laundry, just to catch up on life. So again, I think that that's quite problematic. And again, what challenges do you see for yourself or organization in the work? Do you see some of this? So again, in talking about ethical drift, a big piece of the program also includes boundary conversation, right? So we begin to see evidence that erosion is occurring, like we saw the Robin Williams character. He's going back to work, probably just putting his best foot forward, but then you get a client or a patient that's challenging. And is it the client's fault that they're challenging, or is it up to us to take care of us? And how do we do that? Again, there is no solid pathway, and that's what I'm proposing here today is just to take inventory and notice you. Recognize, what did I get into this work for? Am I honoring that every day that I get up? And then what happens as a result. So there is a way to confirm that the trauma-engaged occupational consequences are showing up. That's in the part 2 and 3. They're called trauma-engaged occupational impacts, another acronym. And how we see that is in our emotional dysregulation and our procrastination. For those of us that maybe stink it at note taking, we can be great in person in session, but we don't carry that through, and then we put that off, and then it haunts us later. And our mental and physical health decline. When's the last time that you went to the dentist? When's the last time you made an appointment for you that wasn't for a family member? When's the last time that you made sure that you had a nice hot meal and maybe some time off? And what that does is it starts to erode our ability. Now, interestingly enough, people that are new to the field have and experience more and espouse more secondary traumatic stress. People that are in the field longer tend to be more cynical and have more burnout, but also have more apathy. They just do what they got to do. They just make it work. And I would like to change that paradigm. I would like to change that conversation starting today. So some decision making might be compromised. Again, we all come from our places and then have this reparative quest that I'm surmising. What's your ACE score? Are you familiar with that? Do you know what you're bringing in with you in the work that you do? And again, is it honoring your path, or is it just more sacrifice? So this is what we know, and it preps us and makes us vulnerable to having these consequences occur. So if left checked or unchecked, it can conclude to personal detachment, maladaptive coping, ethical drift, which again leads to treatment bias. It's a snowball effect. And again, not to pathologize, it's not our fault. It's because even in higher education, we're not necessarily being taught how to conduct ourselves in the aftercare once we've graduated. And once we're in the field, let's face it, most of us are just trying to survive, pay our bills, take care of our families, and call it a day. So again, more on this in the full training. Ethical significance. So depletion of resilience and energy can increase susceptibility to experiencing that secondary traumatic stress. And ethical practice is in all of our ethics. I saw there's some LPCs here, MDs. I've had attorneys come. We have an ethical responsibility to sustain our own well-being in the work that we're doing. And again, not to pathologize, I think it's very easy, myself included, to get away from that. That's, my reparative quest is wanting to figure out some things for myself, and that's what started me on this journey. So one of the purposes of this is to acknowledge the potential pitfalls and gaps to mitigate the development of this. We can stop it before it starts for the next generation, right? I hear a lot of times that a lot of elder mental health providers in the field eat the young. We're kind of maybe a little resentful with people starting out with just this wide eye and very eager anticipation of wanting to do good works. When some of us have been around for a while, we go, even in this seminar, I've heard this before. This is not new news. And you're correct, it's not new. I'm just trying to package it differently and make it a little less burdensome to give it a try. And my thing again is it may not seem like much, but do it consistently. Consistently self-monitor. Figure out what your number is. Consistently notice you. Consistently breathe. We don't do that. So again, breaking the do more with less narrative. Please share in the chat if there's a barrier that you've experienced personally in your organization, if you feel vulnerable and safe to do so when considering implementing an intervention, right? The greatest thing is a lot of organizations, again, not to throw shade, some of them do have wonderful speakers and wonderful programs and wonderful rollouts, right? What happens after a few weeks? It dissipates. It doesn't stick. A big piece of what I did here with the Holistic Resilience Recharge was embed what's called implementation science. Implementation science is basically a recipe that helps see a project through to sustain. So we want it to be sustainable. We want it to be maintenance, right? We want to make sure that we reach a vast audience, but that it sticks. So part of that is, again, ongoing in development. But again, is there time at your organization for notes, for staffing changes, for financial compensation? Do you have a lack of resources, and what do we do with that? So, saying again a lot. So skill practicing, another one is breathing. We're kind of coming to the end here, but a quick scan so we notice where we're at. Maybe check in with a number. Where am I at right now? Is this training pressuring me? Is it making me think of things that are uncomfortable? Is my number climbing or is it depleting? Again, each thing we do will replenish or we will deplete ourselves throughout the day, our energy. So then once we have that, sometimes it's important to breathe. Oftentimes we breathe in our chest. We hold our breath when we're stressed or focused. And this is about diaphragmatic breathing. It's about putting your hand on your abdomen, not raising your shoulders when you breathe. So you want to breathe through your stomach and cool and Darth Vader breath on the way out for those that get that reference. And I would say 1 to 3 breaths. You'll feel a little woozy because you're bringing in some fresh oxygen. No box breathing, no holding, just breathing, expanding your belly, feeling it in your bones, and allowing that parasympathetic nervous system to kick on, right? If we have any kind of stress, any kind of action going on, we're in sympathetic, which sometimes, again, lends us to having less access to our higher cognitive thought. And again, more of that in the other training. Where do the TOCs show up throughout one's career? Again, I said this: early career, high report of secondary traumatic stress; mid-later career, high report of compassion fatigue, vicarious trauma, changing your worldview of, and then leading to that cynicism that does bring us to burnout. What are the unmet needs of each of these stages? So I conducted a needs assessment with about 115 respondents, and it all kind of came up. We don't have enough socialization. We don't have enough tools. But like all of you that know, sometimes tools, they're not a treasure chest box. It's not X marks the map. What works best for you? And can we create, again, energy shifts that allow you to do it? I'm not saying noticing yourself, grounding yourself is new. And I'm not saying breathing is again, revolutionary. You're revolutionary. But how do we get you to do it so that you can actually enjoy whatever it is that you like to enjoy? And are we having these conversations? So a little Q&A. I just want to say, add in the chat, yes or no, if you've experienced one of the TOCs in the past year. Do you identify with any of what I'm saying? Please add in the chat if you're having these routine conversations with colleagues. Are you talking about how they're doing? Are you checking in? And again, if you are, that's amazing. I'd like to take that conversation deeper. What can we do together to collectively shift our energy? And a private reflection, taking some of what you're hearing today, can you align with compassion for the self? We don't want to pathologize, we want to identify. And a big piece of this is knowledge. So your intentionality and the commitment to change, there's no pressure to change, right? You could sit here and go, I got my free CE, I put it on, I'm multitasking, and it's good. Like, she seems nice, Melissa, but nothing new. What am I going to do? So there's no pressure to change, but we do have an ethical responsibility of our chosen profession to make sure that we're well. And I'm saying, why not do this? It doesn't cost anything. It doesn't take up any more time, but a few seconds a day. So the consideration of what micro practices can do for us, oftentimes, as you know, working with the populations that we do, we have to have these big fancy trainings and treatments and certifications when sometimes it just comes down to doing something on a smaller scale, doing something that's not such high cognitive burden because after two or 3 weeks, the dopamine and the newness wears off, and then we don't do it. The biggest piece of this is consistency. In order to reduce your stress, has to be consistent. If it's too much to take on, we're generally not going to do it as time goes on. We're bombarded with cortisol. Our allostatic loads are high. We're not necessarily honoring our reparative quest. So this is a pathway is personal. What you choose has value and matters, and what matters to you might be different for somebody else, but let's share that also so we can expand our resources. Show up for yourself. That oxygen mask cliche, it's applicable here. It replaces helplessness. What can I do? I'm powerless to make change. Sure, that might be very, very real and very evident in all the roles you have, but you can breathe, right? As long as we're talking, we're breathing, and it can foster empowerment. So past pandemic shifts, so where they show up, the do more with less culture, the comparative narrative, right? Sometimes we'll look at someone else going, well, they're meditating every day and I don't have the capacity, or I don't have the extra income for a gym membership, or I can't do this. Again, we don't compare because that's continued self-deprecation, which again takes away from our presence where we notice us and we don't notice anybody else, just noticing you. I think oftentimes we put ourselves lower on our list. And I'd like to change that by breathing, by noticing, self-monitoring. We're putting us higher on our list. So, sorry. So energy check-in, just want to check in again. We're at the end of our training. What's your number? Please share it in the chat. Do you notice any body feelings, sensations? Can you give credit? Again, honoring what this all means to start empirically evidence and quantifying you when we haven't done that before. Gentle reminder, we collectively share a similar and comparable education. So if you find a colleague, generally we can talk about this stuff, right? Generally we have the ability to have conversations. We all come from a similar learning capacity. So we're all of similar education. So these are not forlorn concepts, right? This HRR centers on a shared awareness for the necessity. Peer-based engagement and socialization is huge. All of you coming here today and sharing time is just so incredible. And I'm so grateful that you're here today. Your gentle challenge is considering micro practices that yield you space for more energy. While it may seem more to begin and start, I guarantee you'll wind up feeling better, waking up with a higher number because you won't have as much stress on your shoulders. You'll be able to, step aside of that. So begin shifting the mindset. So the first beginning of the training is pausing, noticing, and monitoring. There's a couple other parts in the longer training, but that's what we're starting to do. Again, nothing new, but I'm asking you to do that with intention. So start the conversation. Let's talk about the TOCs. What's stopping us? Let's differentiate them. We can't glom them together going, yeah, one of those. No, we want to present them as a package, but we also want to be able to nuance them with some of the literature that I shared with you today. Connection and consultation are protective and they're ethical. It's important. The vulnerability piece, sometimes we have to be in this space to do more with less, to, acknowledge the burnout, that it's something, it's a badge of honor, but I want to deconstruct that. Let's change that narrative. I don't know how it started or when it started. Organizational culture, we know will give us that, they'll reward us for doing less, not with money. We want to change that. I want to say a big thank you. I kind of really went through a lot of information today. Thank you for joining the workshop. It's a brief overview. It's much more in depth, and I know it was a lot of material, hopefully some new concepts, hopefully not too overwhelming. But again, for any questions regarding this, please feel free to email me. Feel free to connect with me on LinkedIn. I'd love to talk more about how we heal together. You are amazing. You're all healers. I can't thank you enough for being here today. Warms my heart, and hopefully we'll connect in the future.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or click the link in the description to purchase the course and earn your CE certificate. If you're looking for more CEs, check out our Unlimited plan. You get unlimited access to more than 200 ASWB and NBCC approved continuing education courses and more than 20 live events each year for one low annual fee. We're always adding new and exciting courses. Check it out at agentsofchangetraining.com.